Good morning. Hello, everyone, and thank you for joining us today. My name is Shannon Hamilton, and I'm the Regional Director for Burnaby, Vancouver, and Northern BC at Benefits by Design. I'm very pleased to be joined today by Sheila Karras, the Director of Group Life and Disability Claims at Empire Life. Sheila will be describing Canadian trends in disability, discussing the industry and Empire Life's best practices and new technologies, as well as sharing some stories with us today. Before we get started, I have a few quick notes. First off, this webinar is being recorded. You'll receive a follow-up email with a link to the recording after the webinar. If you have any questions or concerns about this webinar, please contact us at info@bbd.ca. We have preloaded some information that Sheila will be referring to in the handout section of the GoToMeeting interface. Benefits by Design's EAP report is available through the link found in the chat section of the interface. We'll also be running a question and answer session after the main presentation, so please stick around. If you do have a question, you can submit it at any time by typing it into the GoToWebinar question interface, and we'll do our best to address them at the end of the webinar. And now to introduce our speaker. Sheila Karras is the Director of Group Life and Disability Claims at Empire Life. She has worked in group insurance for 20 years. Her career has spanned both the direct and reinsurance markets, focusing on best practices, training, and audit in disability and health claims. She's an active participant in several CLHIA working groups and has earned her Bachelor of Science from Queen's University, majoring in life sciences, as well as her Group Benefits Associate designation through the Certified Employee Specialist program at Dalhousie. Sheila is passionate about continuously improving how we can help Canada's small business employees have the best insurance experience possible. And so without further ado, please let me welcome Sheila Karras. Sheila.
Thanks, Shannon. Hi, everyone. Thanks so much for joining us today. I just want to encourage you to all ask questions, like Shannon said, in the chat box, and I'll ask her to watch for those and let me know if there's any that should be clarified or asked throughout the presentation. But if not, we'll definitely have time at the end to get to all your remaining questions. And just as a disclaimer, I'm not an actuary or an underwriter. So if you have questions about rates or underwriting practices, it's probably best to ask your regional director. So we have a lot to cover today. I'm going to jump right in. And forgive me, I am driving this myself. So I'm hoping that I don't jump too far ahead at all and I keep us on track. I wanted to kick off today with discussing the concept of trends in LTD claims, because this is something we get asked about a lot. You'll see that the stats and trends we display are mostly looking at a 10-year period ending in 2017. Our industry does benchmark studies to capture data and provide information back to all of us, but it takes time, so we usually provide data every couple of years. And this year, I think all of our data analysts have been pretty busy in pandemic prediction mode, so getting updated trends may be a bit delayed, but I can definitely share my own anecdotal notes around what we're seeing at Empire. So to begin, let's look at the two major factors we talk about when we're talking about LTD claims: incidence and termination rates. Every carrier defines incidence a little differently, but generally it's a ratio of new cases to eligible insureds. Termination rate is the rate at which claims resolve or close. And as you can see, this trend starts in 2007, takes us up to 2017, so that 10-year view we were talking about. So the first spoiler alert, things did not improve since 2017, and in fact, that incidence rate increased at a faster pace in 2019. But over these 10 years, there has been a fairly steady, gradual rise in the incidence of LTD claims. You can see that in the red bar on your graph. Unfortunately, the termination rate has not increased with the same slope. The termination rate is the blue line on the graph. So this means we're getting more new claims than we're closing, which is increasing our overall caseload size. And we would love to know the number one factor that contributes to this trend so that we can focus on how to solve for that. But as with everything disability related, it's complicated and it's actually not one big factor. It's really a combination of many different things. So What are some of those things? I'm showing this example of economic factors because I think this is going to be a big topic this year, as we're all curious how the pandemic will impact everything. So let's look back at 2008. We knew unemployment spiked. We thought we'd see a similar spike in claims, but we didn't. As you can see on this graph, there's no obvious correlation. So this could be a positive sign. It could mean we're now able to manage claims more effectively, recognizing the difference between disability and employment concerns, but that's just speculation. As for the pandemic, so far since March 2020, we initially saw a decrease in incidence and LTD claims. We're busy analyzing why this may be. Is it because of the increase in government programs, or maybe the delay in medical treatment leading to a delay in LTD claim submission? We notice we've seen a spike in volume again this month in October, so either of these reasons could account for that, but we believe we'll know more as time goes on and we come out of the pandemic. Obviously, health factors have some impact on disability trends. Not surprisingly, with the rise in obesity, we see that only 2 in 10 Canadian adults meet the Canadian guidelines for physical activity, and diabetes diagnoses have almost doubled since the turn of the century. But the biggest health change and impact to disability claims incidence over the past decade has definitely been mental health. We saw a steady increase in claims related to mental health over the past 10 years, beginning in the province of Quebec, but this trend increased across the country, with the biggest increase we have seen yet in 2019. There could be many different reasons for this. For example, the decrease in the stigma around mental health, more awareness and acceptance of these conditions, side effects of medications, and that's just a few potential reasons. There could also be a very strong correlation between increases in mental health incidents and the health-related conditions on your screen. The question is it the mental health condition leading someone to some of these unhealthy behaviors, or are these behaviors resulting in increased prevalence of anxiety and depression? On a positive note, recent data suggests declining incidence rates for a number of chronic diseases in Canada. A report analyzing national data over the period of 1999 to 2012 from the Canadian Chronic Disease Surveillance System identified decreasing overall incidence trends for diagnosed asthma, chronic obstructive pulmonary disease, hypertension, ischemic heart disease, and stroke. More recent data reiterates the continuation of these trends between 2003 and 2016 for all described chronic diseases, and points to a declining incidence rate for diabetes starting in 2006. The observed decrease in chronic disease incidence rates may be influenced by factors such as varying strategies used to diagnose, manage, and report chronic diseases across the country. Further investigations are needed to fully understand these observations, and I bet I know what you're all thinking. COVID-19 may completely change this progress. The rise in the incidence of mental health issues has definitely impacted all of us over the past 4 years. In this diagram, you can see why it's resulted in an increase in disability claims. It's because the percentage of cases that are higher risk or more severe has increased. We also know that about 1/5 to 1/4 of the working population in Canada is currently experiencing mental health conditions, a stat that is probably even higher right now to reflect the additional stress, anxiety, loneliness, and depression created by the pandemic. We need to find a way to treat mental health issues earlier and help people access the right tools so that mental health issues don't affect their lives at the same level of severity. So we'll talk a lot more about that later on in this presentation. We wanted to make a few notes about the impact of COVID-19. And like I said, some of the trends we're starting to see. So early on in the pandemic, we were all trying really hard to predict the impact it would have on our working population and the insurance industry. I thought that was probably an actuary's dream. Fortunately, some of our worst predictions did not play out to be as catastrophic as we imagined, but it's still early on. We could continue to see side effects of the pandemic for years to come, including the so far unknown long-term effects of COVID-19 survivors. In Canada, one of the biggest populations impacted was residents of long-term care homes. This could change the trust people have in putting parents and grandparents in these facilities, meaning we could see more of our workforce in that sandwich of caring for elders and children at the same time. And as we've learned in recent years, this adds a lot of stress to people who are trying to balance caregiving, work, and their personal lives. Other potential future impacts include the possibility we may see late claims roll in as the government starts to audit and claw back on benefits like the CERB. And we've already started to see lawyers advertising to LTD claimants who've had claims declined or closed during the pandemic. I'm going to switch gears now to talk about what work we're doing to manage all of these disability claims. Claim management has evolved over the decades, and some of the emerging elements are very exciting for those of us in the industry. As claim management is ever evolving, there have certainly been a lot of changes in the 20 years I've been working in this field. There are elements that have remained the foundation through time. So you'll recognize a lot of those tools up on your screen. I'm just highlighting a few of the tools to emphasize the great work we do at Empire Life. And Empire Life's claim management excellence document is one of the handouts Shannon mentioned that's attached to the presentation. One of the best examples of the traditional tools that have been in place for a long time is a home visit with the claimant to help get a picture of everything that's going on in a person's life. This can be really useful, especially if English or French isn't the person's first language. We can even arrange to have a translator at that meeting with them. At Empire Life, we not only apply the right tools at the right time in a claim, but we understand when these need to be altered a little to meet the needs of our small business customers. So let's use return to work planning as an example. Our customers may have hired a temporary contract worker while their employee is on leave, and they can't afford to pay both during a gradual return to work. So we take that into consideration and look at alternatives like paying a full benefit until the employee is back to full-time hours. Or we might use a simulated work hardening program outside of the workplace to help them get back to their pre-disability level of function. Over the years, newer tools like the Claim Lab questionnaire, pharmacogenomics, and online cognitive behavioral therapy have helped us fine-tune our assessments and get faster return to work results for our customers. And we're continuing to explore what tools are available to assist us with claim management. Some of the research we're looking into now is around 3 different areas. So the first, are we able to use some of our historical data about correlations between drugs and LTD claims to help us provide alerts early on so pharmacists and physicians can help customers get on the right medications and adhere to the proper dosage? Second, there's a lot of discussion about the potential of using health tracking tools and devices to give incentives or lower rates to insurance customers. A lot of these are already in place in the P&C field. And third, to help manage long-term claims, we're exploring the use of AI to alert us to activity on the internet that we may choose to investigate to determine if claimants have been able to increase their level of activity. Okay, we're going to move on now to one of 2 polls that we've inserted into our presentation today. So I believe Shannon has the poll open for you.
Okay, answers are starting to come in. Thank you for all those that are participating. All right. So there seems to be quite a few indicating dedicated and compassionate case management. Quite a few don't have any experience with Empire Life yet, Shelley, but it looks like the answers are kind of trickling in now. Wait for a few more votes to come in before I close off this poll. Okay, let's see the results.
Okay, thanks for answering our question. So it looks like the #1 answer with 62% of the results is newcomers, people who have no experience with Empire Life. So welcome, I'm really glad you've joined us today. And interestingly, we didn't have anyone respond that Empire was known for leading research and techniques. So this is a really great opportunity for us to introduce you to something really unique that we have participated in, a research project that is unique in Canada and has really captured the interest in the industry. So everyone's talking about data and analytics in insurance, and claims is no different. In disability claims in particular, we're often the last to get on board. And it sounds like you don't think claims departments are much known for research and data techniques either. We're the last to go digital. Our old claim systems don't hold a lot of data, and disability in itself is pretty complex. So if we look back on the history and analytics for disability claims, I think we would all agree that case managers are the first line of analytics. We often talk of the transition of claims management as an art that is transitioning to a science. So we're the art. The case managers are trained to review, assess, and request the right information and conduct telephone interviews. We're skilled at taking that information to making a decision and then to planning a successful return to work or resolution to the claim. It's that feeling we get when we know there's something that we need to know more about to really grasp what's going on with the claimant and acting on it. I would call that analytics in its most traditional form, but you might call it curiosity or intuition. And then there's the science. So I often hear the question, is there a formula to disability management? We all believe there is, but how do we put this into a calculation or a process that an actuary or data scientist could identify with? That's what we're trying to do more of. So I love this equation up there that really demonstrates what we're talking about. And I've been doing a lot of grade 12 functions homework with my daughter, so could solve for that n up in the exponent section. But how do we put this art and this science together? So we need all parts of what we do for efficiency in our work and to inform our decisions for the best customer service. But we also want to find a way to manage claims more efficiently. We want to do better for ourselves and our work, but we ultimately want to do better for our customers to help them recover and get back to work. Doing better for our customers also means we're doing better for all of our group customers, the employers, which is a good thing for business, which is good for all of you. So how do we do that? We do that by using different data sources to inform our case management. And claim scoring is one element. Claim scoring is not new to our industry. It's taking the data from approved claims and assessing the likelihood of current claims resolution based on that claim history. But as we said, the data that we have in our systems has been limited. So at Empire, we started on a project with the Claim Lab about 2 years ago to help us learn more about the claimant and the employer and create a score using claim data we never used to have. Lots of research has been done to identify what are the key factors preventing a disability claimant from returning to work. And one of the most common is motivation. but this has never been something we've been able to predict before because it involves all of the psychosocial information we didn't used to have data about. So let's use an example to demonstrate how this extra data helps us. With the normal claim data we have, if these two men, Tom and John, went on disability with the same diagnosis, these claims would look identical and be scored the same way, leading us down the same treatment and claim management path. However, with the claim lab questionnaire, we might learn that Tom is very successful at work, up for a promotion to foreman, which will involve less physical work, and there's no secondary conditions or other concerns. But with John's responses, it was highlighted that he's been struggling at work and he's limited in transferable skills, both from a language and an education perspective. He also scored high in the mental health questionnaire as he's experiencing anxiety and depression, which he's not discussed with his doctor. And he noted that his medication is not helping him and he's not sleeping more than 4 hours at a time. You'll see with the addition of these other aspects of the claimant captured in the data, we can fine-tune our comparison of Tom and John to the historical data and quickly see that John is less likely to return to work than Tom. And that helps us recognize that when Tom's physical condition has improved, he's really very likely to return to work without any assistance and even capable of returning to alternate employment. John's claim would be identified as one that could use some additional work from us to help him get into the right treatment program, which would help him with his anxiety and depression, and suggest some tools that might help him get the right medication for him and improve his sleep. So here's a list of the categories we capture a score on, and the score helps the claim manager identify the areas of focus and assistance a claim requires. And over the long term, this will help us assign claims appropriately, balancing the workload of claim managers and helping the right claimants get the right help at the right time. It even allows us to fast track some claims that don't need any intervention from us. The claim scoring can be a difficult concept to understand, so I'm going to use a few case studies to demonstrate how it's helped us so far. So the first is Sarah, and in Sarah's case, the claim lab questionnaire alerted us to the fact that she was not sleeping more than 4 hours at a time. You might notice that is something we hear a lot about and really impacts someone's ability to return to work. So we know that this response suggests that a claimant will have a difficult time unless the underlying reason for that sleep problem is uncovered. So we suggested she get in touch with her medical second opinion provider, Humanicare. They were able to identify an underlying anxiety around return to work during the pandemic, and together we were able to help her get the right treatment to be able to address her anxiety, resulting in better sleep and less fatigue, and a successful return to work. So information about the medical second opinion provider is another one of the handouts that's been linked to the presentation. Another benefit of predictive analytics is, like I said, to help us identify claims that need very little review and assessment on our part. So we have had examples where I think I've skipped a slide, but we had a case where someone had a devastating condition like ALS, for example, and the questionnaire helped us see that there were no concerns at all and we didn't need any more medical information. And we were able to fast track that claim and help that claimant apply for CPP. The next one that is up on your screen is Mary. In Mary's case, our predictive analytics tool showed a high score in motivation and highlighted that early intervention would help put Mary on the path to success. So her claim was immediately referred to our rehab team upon approval, and she was connected to the appropriate treatment provider, resulting in a return to work in 3 months. So we're going to move on to talk about mental health now. We've talked a lot about it before, but we're going to focus on this topic and tell you about our strategies to help our customers with the particular aspect of their health that's impacting the most of them. Many people have a mental health diagnosis. Stats say it's about 1 in 5 Canadians. But what's important in disability claim management is to understand that that diagnosis doesn't always mean lengthy time off work is required. One thing that's really important for claim managers and anyone working with disability claims to understand is that our own personal bias may actually affect what we think should be happening with the claim. For example, if we know someone who has suffered from depression, or if we've been through it ourselves, we might expect a claim with the same diagnosis to follow the same path as ours. This is actually true with physical diagnoses too. So think of the instance of breast cancer, and if you or someone you know has gone through that, you might expect that all situations are going to follow the same path. So if we were able to continue working, we would have a harder time understanding why another person couldn't. But if our experience was that the diagnosis, like depression, was severely disabling, we would expect the claim to be approved right away. I think we can all agree that the earlier someone receives the help and support they need, the more successful they will be in returning to work. That's why the next slide I'll show you shows the most opportunities are arriving in that prevention stage. So what are some of the things that can be done on the prevention front? The majority of the work we can do to help people with their mental health condition is in this phase of absence management. Small business owners may not have the HR capacity to understand and implement effective programs and accommodations. So any services that you as advisors can recommend to assist them will benefit them in the long run. Some of the benefits we frequently link to LTD plans include pharmacogenomics and medical second opinion. Although these benefits can really be applied anywhere throughout someone's illness, the earlier a person has access to them, the higher the likelihood they'll be able to stay at work. EAP is one of those important preventative tools that we'd love to be available to more of our plan members. So the EAP ebook is another one of the handouts or connection links, sorry, that's included in the handout section of the presentation. But if someone does have a mental health condition or other health issue that prevents them from working, it could turn into a short-term disability claim. And our disability team at Empire Life manages these claims with the same effort and tools we would apply to an LTD claim, recognizing the benefit of helping people get back to work as soon as possible. So what that means is introducing something like a rehab program or implementing pharmacogenomics or cognitive behavioral therapy, or helping someone fund their treatment program if their EHB benefits have been exhausted. We don't wait for the LTD phase for that. We'll start that right during that short-term disability phase. As we've said before, once someone's been off work long enough to apply for LTD, it can be very challenging to resolve with a return to work. So applying that predictive scoring tool we talked about with the claim lab at the onset of our LTD claims helps us make the process as efficient as possible and get people on the right path right away. We have noticed that although a claim may begin with an objective physical condition, often this evolves into a mental health condition that delays the return to work. So the example of Sarah from the earlier case study was someone who started their disability claim with a heart condition, but once that condition resolved, they needed assistance with anxiety. Using the tools we have available to identify these secondary conditions early on drastically reduces the amount of time someone is off work. And what is really key with that is more often than not, some of these patients have not discussed their mental health concerns with their physician. So if we were relying on the medical information alone, we would never know about that. Now, two of these tools that I've talked about a bit in passing through the presentation are fairly new. So I wanted to spend a bit more time explaining them. The first is the ICBT. So that is the cognitive behavioral therapy that's done virtually or online. And cognitive behavioral therapy in itself is not new. It's been a known effective treatment for mental health conditions for many years. But what is new is the ability to provide this treatment virtually to anyone with a device and an internet connection. These programs are tailored to the specific needs of the individual and can match the customer with a provider who is a best fit for them. So at Empire, we had begun to work with an online CBT provider early in 2020, and we are very glad we chose to do that because it became one of the most accessible treatment options during the pandemic. But it's not just for that pandemic situation where the treatment provider offices are closed. A lot of times people don't have access to treatment because they live in a rural area, or maybe they live in a metropolis where the waiting lists for these kinds of treatments are months and months and long. And also sometimes people still feel that stigma of entering a treatment provider's office and who might see them doing that. So the online option can be a really good option for many of our customers. Another issue we see with many disability claimants is noted in our claim lab responses frequently as well. And that's the side effects or the inefficacy of their medications. And sometimes it's the second, third, or fourth medication they've tried and they've gone through horrible side effects with each one. So pharmacogenomics is a test that determines if someone's genetic makeup affects their ability to metabolize certain medications. And it makes recommendations for alternative options. These reports aren't sent back to the insurer, but rather the customer's physician, so they can work together to find the medication that will work best. Sometimes by the time someone's been off work long enough to apply for LTD, like I said, they've already gone through several trials of various medications, which is why this tool may be even better if applied as soon as someone is first prescribed a medication. And also keep in mind, this pharmacogenomics tool might not identify someone's inability to metabolize a medication in every case, but even if it helped 5% of the people get on the right medication right away, that would be a huge impact. So having always been a science lover, I'm really excited to see so much research being done to provide solutions for our customers. I'm going to share a couple more case studies with you, and hopefully I don't skip a slide this time. But first, I want to start with one more easy poll. This one's just a true or false.
Okay, I'm just pulling that up right now, Sheila. Okay, here we go.
Okay, we're starting to
get some answers in. Yeah, that's right. That's right. Okay, well, wait for a few more, but we're definitely leaning towards the majority. Feeling the answer is true to this one, Sheila. 98% believe that this is true. So I'm just going to close off the poll here.
Okay, it's a very interesting result. So I'm going to read this out loud to lead into our next case study and go over this. So the question was, people go off work for many different reasons. For example, they might be a caregiver, or they've lost their job, or they might be injured or ill. And we asked you, true or false, disability benefits cover absences for all of these reasons. And actually 98% of you said that this was true. Which is interesting because this is actually false. So of these different reasons why someone would go off work, the only absence that disability insurance covers is if someone themselves is injured or ill. So our next case study outlines one of these. And so I'm really glad that you joined us today. So if you understood the true or false correctly and you felt that that was true, that disability would cover all of those different options, this is a great opportunity to talk a bit about that. So in the case of Adil, we do see this actually from time to time, and it's quite heartbreaking for us as claim managers. We recognize that there are definitely cases when someone who has a sick child or a spouse and they're the caregiver for that person, that they're affected to the point where they aren't really able to function themselves anymore, and in fact may not be able to care for that person anymore either. So in those cases, you know, we would consider their disability. But in Adil's case, he was doing okay. And actually, he was able to track his wife's treatment. He was taking her to appointments. He was able to manage the household, including a lot of activities that he didn't do before. But he wanted to be off work to spend the time with her. And most of us would probably do the same thing. I know I would. I would take that time off work. So our job was to help Adil understand we weren't suggesting he be at work during this time, but we guided him to the employment insurance benefit that he would be eligible for. So the next case study describes another really difficult situation for us to interpret, and that's when there are problems in the workplace. So we need to assess if someone's underlying condition was the reason they stopped working, or if their absence from work was more of a way to deal with or really not deal with their situation at work. So in this case of Maria, recent events were triggering her long-time depression, and her medication wasn't helping the way it used to. And that's a really key factor in the assessment of this claim. The issues that were happening in the workplace weren't causing her absence from work, but she certainly wasn't going to be able to return to work to that environment. So her claim was approved, and she was connected to the right treatment and provided with assistance in preparing for a job search. So I'm hoping that those two case studies help understand what we're looking for in those difficult situations a little bit, but I'm definitely happy to discuss that further if any of you have questions. Just one last slide before we get to the question section. We want to talk a little bit about some common questions that you might get and how you can best provide the best customer experience. So, like the case of our poll, that true or false question, a big thing that we need to help our customers understand is that long-term disability or short-term disability is really just for one bucket of work absence, and that's sickness. That is if the employee, the insured person themselves, is off work due to their own medical condition. So other benefits like employment insurance have buckets for absences from work that are not due to the employee's own illness. And they have quite a few. And even coming out of the pandemic, they've changed that CERB from that all-encompassing bucket to really identify the different reasons that someone's not at work and help them get the right benefit. Even if the benefit amount is the same, it's called something different. So we anticipate it could be a big topic in the coming months and really years as the impact of the pandemic and layoffs and all the other factors encompassed in that increases. Also, as claims professionals, we need to make sure we're not influenced by our own biases when we're thinking about a particular claim or situation. Everyone responds differently to a diagnosis. Everyone has different levels of function. Everyone has a different job, and employers handle accommodations differently. So with so many permutations and combinations, it's rare to find two claims exactly alike. And we have to remember that our customers might not know a lot about disability benefits. Most customers have submitted several EHB and dental claims, and that's their expectation, I find, with all benefit claims. So they expect they submit the form, they receive their reimbursement almost right away. but disability claims take time to gather the required medical information, understand the job from the employer and employee perspective, and determine someone's ability to work. So as advisors, also, I ask you to please think about all the preventative tools we talked about. A good EAP program, a medical second opinion option, and remember, we've included those handouts with this presentation. Tools like pharmacogenomics and other income source benefits like critical illness can all benefit our customers and help reduce the number of employees going off work on disability. So as I said, that was the last slide in my presentation, and I would love to turn it over to our panel of questions now. So I'm going to get Shannon to help me identify if there are any questions that have been submitted.
Thank you, Sheila. So just looking at the question pane right now, waiting to see if there's any questions here. Okay, so here's one. Why would a claim be declined if the doctor says someone is unable to work?
Oh, that's a great question. So a doctor, and this changes, it changes from region to region and it changes from year to year. But what we find a lot is that doctors don't always necessarily know what somebody's job is or what is happening at work and outside of work. So if you go in and you have, I always use myself as an example. As you can see, I'm sitting in my home office and I'm talking. So you wouldn't even know if I had a broken leg or not. But if I did, I would certainly still be able to work. But if I was a roofer, that broken leg would definitely keep me off work as long as I was in a cast and couldn't wait there. So, you know, if the doctor doesn't have a good understanding of what our job is, he may just complete the form and say, yeah, the person's unable to work for 6 to 8 weeks because they know that's the length of time I would be in a cast for. So our job is to take the medical information and combine that with the occupational information and determine if the person's able to work.
Great answer, thank you. Another question. How freely, legally, can you investigate a claimant's Facebook and other social media sites for claims investigations?
Yeah, there's actually no law preventing that, as long as we're looking in the public realm. And for most of us, we're not hackers and we would actually have no idea how to look outside of the public realm. So if we're just Googling somebody, if we find their Facebook account and we see what they've posted, we look on LinkedIn, you know, there's other things out there that we might see, that's all allowable. What is important is that we have a reason so that we're not just, you know, looking for information on everybody. A lot of carriers have it their general process just to make sure they're looking at the full picture of everybody. They're not really searching for anything bad. They just want to make sure they haven't missed anything. So a lot of them just Google every single claimant, and that's fine. And you're not going to further investigate unless something comes up that says, you know, perhaps someone's level of activity is different from what they're reporting to you. So that's all definitely allowed. We just have to make sure that we document why we looked into that, if it's our regular standard process, or if there was something that alerted us that something might be going on.
Sort of a part B to that question, Sheila, is do you or Empire Life routinely Google a claimant and Facebook? Like, is that a routine part of your claims process?
Yeah, absolutely. We do. Like I said, Claim Lab helps us identify if there's things where no matter what, it wouldn't matter. So the diagnosis of ALS is a great example because it's pretty finite. It's very disabling. There's no recovery from it. And so a lot of that other stuff that might be going on, you know, if someone was having problems with their employer or something like that, that wouldn't impact someone's ability to return to work. But, you know, the cases where it's more subjective, so someone's talking about pain or fatigue or something like that, we just make sure that we're looking. And we also use it on on the long-term claims as well. So if someone's had a severe diagnosis and we've put them on maybe that permanent disability path, and then 5 years later we're doing a recheck, we might just Google them again to see if their level of function has changed. They might have started working somewhere, and it may or may not impact their disability claim. But they also sometimes don't even think about needing to alert us of a change in ability or a change in employment.
Thank you, Sheila. Sheila, you noted the growth in legal activity in Canada and litigious ads. How has this affected how insurers approach claims and costs within the system?
How it approaches claims is as we're training claim managers and just in our daily discussions, we're always reminding people to follow our processes and make sure they're documenting everything, just because you really never know. You could have a very straightforward claim that results in a return to work that you think has been a great success, and you know that the lawyers out there sometimes still solicit people for strange things. So we just never know. We want to make sure that we've got great documentation on our file. And like I said before, if we've done any sort of investigation, that we've justified why we looked into that. And we want to make sure that the claim managers are aware of all of that. And as far as costs go, we want to make sure that we are once we have a litigious claim, we want to make sure that we are not just resolving every single one of those situations in a settlement, that if we have a case that we feel maybe we want to hear a judge's opinion on in a pretrial, that we'll take that to that stage, maybe more than we used to. And we're finding that lots of times the judges are willing to say to those lawyers that, you know, the disability team has done their job and made a correct decision, and it's not really appropriate to take that further. So that's been a big success for us as well.
Thank you. Would an insurer, in this case Empire Life, consider investigating counseling in disability claims related to a traumatic event? The assumption would be that an EAP has been exhausted and any insured psychology, social worker benefits, and there's argument that the counseling support may help a more rapid return to work.
Yeah, so if somebody has gone off work and they've been having that treatment and just wants additional help and doesn't have the funding for it, that's absolutely something we do. And actually we do it quite often. So if someone's working with a provider who's really helping them and there's a goal to eventually return to work, you know, we could fund the further sessions with that provider, or sometimes we recommend a change in provider if we feel that the treatment isn't really return to work focused.
Okay. Robert, does that answer your question? All right. If not, just ping back here. I've been asked if we can share your presentation with attendees, Sheila. We don't have a way of emailing attendees through the way people registered. Would you be open to us posting your presentation in the Hangout section of this presentation, and Jake can upload it for everyone to download?
Sure, that would be great.
Okay.
And if people don't have a chance to do that, I know when I try and download a PowerPoint, it sometimes churns for a long time. So depending on your internet, if you can't do that, maybe if you reach out to your regional director with BBD, they can definitely get a hold of that and get it back to you.
Absolutely great suggestion, Sheila. Another question here. We've got about 10 minutes left, so please encourage you to add more to the question pane. This is linked to using data to improve outcomes, but even before there's an employee absence. Do you see using drug claims data as lead indicators? For example, if you saw a first start on a mental health drug, could you message the plan member for other services like CBT, etc.?
Someone is right inside my head with that question. That is something I would love to help people connect with. So, you know, for example, if an employee, the first time they fill a prescription for a mental health claim, for example, or pain would be another great one. If the drug claim provider had an alert for them that said, hey, you know, did you know about this treatment option to do online CBT or pharmacogenomics. You know, oftentimes people have side effects from medication. If you're interested in this test to determine if this is the right med for you, we'd be happy to help with that. I'd love to see those kinds of things, you know, connected to benefit plans. So we're not there yet, but that's definitely something that we raise a lot, and I think it would be really, really helpful.
Excellent. Thank you. Another question. During the first 24 months of someone being disabled, is Empire amenable to assisting with the private cost for MRIs, private specialist costs to expedite the diagnosis?
Yeah, absolutely. And again, that's something we do. Sort of our rule of thumb when we're looking to approve a cost like that is that the hope is that we're thinking that with expediting those things or funding those things, it would help resolve the claim earlier. So if we knew that someone unfortunately was never going to be able to return to work, it may not be cost effective for us to fund those things. But we do see very, very often in this country that someone is waiting for an MRI and then they're waiting for maybe an orthopedic surgeon appointment. And so if we can expedite and fund a private MRI and an independent medical exam, or help connect someone to their medical second opinion provider, then you know, we're not getting a treatment faster, but what we may be able to find is that they don't need a treatment. So if we knew by the end of next week that you actually don't need surgery to help your shoulder and you just need some physiotherapy that we would also set up and fund, we could have you back to work in 6 weeks. Whereas if you had waited for the public MRI and the public specialist appointment, it might be a year or a year and a half. And, you know, by then you haven't had the physio and now you've got frozen shoulder and things like that. So that's definitely something we do try and expedite. And one question that's come up a bit with the pandemic is, would carriers look into private surgeries and funding private surgeries? And that's a bit different. There's a lot of liability involved with surgical interventions, and not every province has the same options. So, you know, in the past, we may have had settlement options where someone's just asking, they want to go out on their own to the States to do a special surgery or something, and we may settle the claim and they can use the money for that purpose if they want. But as far as us arranging them and funding them, we try and stay away from surgeries.
Okay, thank you. Another question here. So as it relates to a disability claim and Empire's, you know, now in the review process of it, what information can an advisor or the employer have access to as it relates to that claim?
That is a great question too. And this is where I want us to really work together. And so if we get a question from an advisor who isn't aware that we can't share confidential medical information, then we would let them know that that's the situation. But we try and tell you as much as we can to help you understand, because what we find is you're probably getting different stories from different parties. So I'm going to use an example recently, and this is true. We had a claimant who the diagnosis was a preventative claim. He wanted to be off work because he was worried about his health condition and being more at risk for COVID-19. And we explained why disability doesn't cover preventative absences. So he then told us that he had recently had a stroke and had side effects from the stroke. So the medical information was gathered, and there actually hadn't been a stroke, and he wasn't even experiencing any side effects that might have made him think that he had had a stroke. So we had the advisor asking us, why we were not paying this claim, and going from the gentleman's story himself. So we were able to tell that advisor that the medical information we had didn't support what the claimant himself was telling us. So although we can't give all the details around it, that helped the advisor understand what was going on with the claim.
Okay, thank you. What techniques or strategy does Empire have in place to assist in having the attending physician's portion of the form returned in a timely manner? And have you seen a drop-off in timely responses since the beginning of this pandemic?
Good question. We actually haven't seen a drop-off So we categorize it. We look at medical in different categories. The provincial healthcare records is a completely different story. If we need records from the government, that has definitely taken a long time. And at the beginning of the pandemic, took even longer. But as far as getting it from medical offices, it didn't. And I think actually with having fewer patients coming into the office, they had more time to catch up on their paperwork. So we were getting responses faster. We haven't seen a big issue. We do have a follow-up process. So we make sure that once we've sent them that request, we follow up with them and just nudge them a bit to get that to us or give them a phone call. We send our requests out by fax, so we're not, relying on Canada Post or anything like that. And most cases, we do get the medical back within 10 business days. But like I said, we definitely follow up with them. Physicians aren't great at corresponding by email, but if we were to have that email address of the physician, then we would start to use that as well.
Excellent, thank you. Okay, one last question. How long does it take to make a decision on a disability claim? I guess it depends on the type, but yeah.
Yeah, that's another great question. And something that you might hear a little bit different with Empire Life talking and other carriers. I think other carriers tend to give a turnaround time from the date they last get all the information they need. So if they had 3 pieces of information outstanding, the date they get that last piece of information back is when the clock starts ticking, and they say about 10 business days from that point in time. But that doesn't give a good picture of how long it takes for the customer overall from the day they submitted it. So I would say, to be honest, on average, it can take about 3 weeks to get a decision on a claim, and obviously longer if we have to have those provincial healthcare records to make that decision. But in general, the time that we take is less than 2 weeks. So if we're not having to request additional medical information, just the time that the claim manager is spending with the telephone interviews, reviewing all the information on file, talking to our medical consultant, and then getting their manager sign off if needed, within 2 weeks.
Okay, thank you. So it looks like that's all of our questions for the webinar. I do want to say a big thank you to you, Sheila, from Empire Life, for sharing those great insights into disability with us. A quick reminder before we part ways that this webinar has been recorded, and the recording will be emailed to you at the end of the webinar. It looks like Jake has uploaded a copy of the presentation to the handout section of the interface, so please grab that from there now. And if that doesn't work for you, we certainly encourage you to reach out to your Benefits by Design regional directors, and we would be happy to forward you a copy. CE credits will be emailed to the email address that you provided for this webinar. You'll also be receiving a follow-up survey, which we would love for you to complete. Your feedback is used to inform future content decisions and improve on our events and webinars. So thank you for joining us today, and we do hope you enjoy the rest of your day. Bye for now.
Bye. Thanks, everyone.
Thanks, Sheila.